all of these things do seem to help frozen shoulder, but very few of them really address the muscle contribution to the situation. And I think that's why this conversation is so important today, and it's also why so many people see improvements in their symptoms, in their mobility, in their strength when they're also adding in muscle activation techniques to their current regimen.
Welcome to the Exercise is Health podcast, where we're talking about exercise, health, and the interconnectedness of the two. We are your hosts, Charlie
and Julie,
and we will be coming to you every single week from our studio, Muscle Activation Schaumburg. Hey, welcome back, everybody, to the Exercise is Health podcast. We're your hosts, Charlie
and Julie,
and we are coming to you from our studio, Muscle Activation Schaumburg in Schaumburg, Illinois. Now, at Muscle Activation Schaumburg, we believe your health is your most valuable asset. Your health is one of the biggest influencers of the quality and quantity of time that you have. And while there are many aspects of health, our expertise is exercise. Exercise has been proven time and again to not only improve your health, but also increase your longevity and improve your quality of life. And if you're looking for a way to exercise on your own while still receiving the quality of guidance that we give our clients here at Muscle Activation Schaumburg, then you need to check out our virtual membership program. This is why we created our virtual membership program, to help people exercise on their own while still receiving customized exercise guidance. So if this is of interest to you, head on over to matschaumburg.com, click on the membership tab to learn more and potentially enroll. Now today we are talking about a topic that oftentimes prevents people from exercising, and we want to talk about it and tell you how we view this subject through the lens of not only exercise but also muscle activation techniques, which is one of our specialties here at Muscle Activation Schaumburg. And this topic is frozen shoulder. Now this is something that is not uncommon at all, especially as people get older. They may notice that their shoulders get painful, they're not moving as well, and these are some of the kind of telltale signs that then lead somebody to go get a diagnosis of frozen shoulder. So if you feel like you've been experiencing something like this, if you know of somebody who's been experiencing this, or if you have experienced it in the past, listen up, because we have some tips for you.
Now, before we start talking about frozen shoulder, I do want to preface this conversation with the fact that muscle activation techniques does not treat, and I'm putting this like in air quotes, it does not treat things that are diagnosed, for example, frozen shoulder, or, we've talked about other ailments like, impinged things or plantar fasciitis. MAT is not designed to treat conditions like this. What MAT is designed to do is to improve the muscle system that could be in a large way contributing to these issues. So when you're listening to this podcast, please don't mistake it for, a medical treatment for these issues, because MAT is not that, but MAT can have a huge impact on helping to improve the situation, helping to improve healing in the area. So just keep this in mind as we start talking about this topic today. As Charlie said, we do see a lot of individuals with frozen shoulder, and there are a lot of things that are currently out there that are kind of prescribed or suggested by doctors for frozen shoulder. And those are things like PT or massage. Also, a lot of people will get some kind of injection. I've also heard of acupuncture for the issue. And all of these things do seem to help frozen shoulder, but very few of them really address the muscle contribution to the situation. And I think that's why this conversation is so important today. And it's also why so many people see improvements in their symptoms, in their mobility, in their strength when they're also adding in muscle activation techniques to their current regimen.
Now, before we get too far down the road of what to do about frozen shoulder, let's take a step back and actually define what frozen shoulder is. So the technical name for frozen shoulder is adhesive capsulitis of the shoulder, okay? And it's typically characterized or thought to be characterized by a thickening and tightening of the shoulder capsule. So your synovial joints, they have this joint capsule around it, okay, which kind of gives some structural stability to the joint. And it's thought that with frozen shoulder, the joint capsule there gets thicker and it starts to tighten up. And as a result, there's the symptoms of pain, there's the symptoms of less joint motion happening. And so then because there's less joint motion, the shoulder doesn't move as much, and it looks outside looking in, looks like it's frozen, okay, where it's not moving much. So a lot of times, this shoulder pain, this shoulder tightness, it can come on. It can be something that it doesn't develop like overnight, but it can start off as like a little ache and then all of a sudden become a bigger and bigger and bigger deal. And so if it's something where you're experiencing some kind of chronic shoulder issue or whatnot, definitely it'd be worthwhile to go get something checked out. Don't just rely on this podcast here to be like, oh, this is what I'm going to do about it. Like if you are experiencing something within your body, go get your body checked out. We just want to approach it from the standpoint of, hey, this is what we've seen with a lot of our clients that have come in with frozen shoulder, and we just want to share our experiences about that to provide a different viewpoint, like Julie was saying, that's more focused on the role of the muscular system in helping people that have been diagnosed with frozen shoulder or that are recovering from frozen shoulder or feel like they have frozen shoulder coming on and they want to stop it in its tracks.
Now, Charlie had mentioned the way that frozen shoulder is typically described as the thickening and tightening of the shoulder capsule, but the shoulder is actually a really interesting area of the body. Each joint is where two bones come together. So what we normally think of as the shoulder is your upper arm bone called your humerus, kind of like where you would show your bicep muscle, and there's like this, it's almost like the top of a golf tee that is of your scapula, which is your shoulder blade. So your shoulder joint, which we call your glenohumeral joint, is where your humerus, your upper arm bone, meets with the little concave surface part of the shoulder blade, and that's called the glenohumeral joint. Now, the shoulder doesn't just stop there. A lot of joints are just two bones like that. But the shoulder has this really interesting, tricky thing involved with it, and that is the shoulder blade. And you're probably like, what's so tricky about a shoulder blade? Well, here's the thing. The shoulder blade has a very interesting relationship with our body, and specifically with the back side of your rib cage. Now, a lot of times we think about your ribs as like, on your front side, they kind of like are the sides of maybe your abs, but actually our ribs wrap all the way around. So if you think about your spine in the back, all of our different vertebrae, those little sections of your spine, there's ribs that come off of it and wrap around. And they actually start right under your clavicle. So think you have ribs that wrap from the back to the front, starting right under your clavicle, your collarbone, and all the way down until the part where we typically call ribs, which is that kind of that front side to our ankles. We call it the costal cartilage here. So the shoulder blade or your scapula kind of glides along the rib cage. And this is really important, and the relationship between the scapula and the ribs can be really, really impactful on the shoulder. And I want to take that back. It's not that they can be really impactful, but it is really impactful. And so normally we have this joint. A normal joint is what Charlie described, where, we have two bones coming together. There's a capsule that goes around it, and then muscles make this joint move around. And that's how most joints are, like your glenohumeral joint, your elbow joint, your hip joint, your knees, all the joints. But what's interesting about the shoulder, again, is this scapula thing. The scapula, which glides along the rib cage, is not a true joint. I think in different books I've heard it like described as like a pseudo joint. Is that
a physiological joint? A
physiological joint. So anyways, all different types of modalities are trying to describe this interesting relationship here where there's two bones, or a bone plus a couple ribs, are having this relationship, but there's no capsule and there's not a lot of, what do I want to say, like a physical structure. So if you think about, like, if you take one hand and make it a fist and take the other hand and kind of put your hand around it, it kind of like cups the fisted hand. That's kind of like how a lot of joints happen, where it's like there's a surface or a contact point that that the two bones are meeting. What's interesting about the shoulder blade is there's not really this contact point. And so the result of that is that muscles are completely in charge of controlling your shoulder blade. So if your shoulder blade isn't moving very well, we can assume, or we can investigate and find out, well, what the heck are the muscles doing? Because the muscles are 100% responsible for all the contact here. I mean, there's no joint capsule. There's nothing else like keeping this, together. There's no like ligament that attaches, the scapula to the rib cage. So when we're thinking about the shoulder, we really have to start at the foundation of the shoulder. And that really starts with the scapula being controlled with muscles only on the rib cage.
This is such an important point to understand, that your scapula, your shoulder blade, is solely positioned and controlled by your muscles. So if your muscles aren't working well, your shoulder blade is not going to be able to move well, it's not going to be able to position well, and it's not going to be able to be stable. And the problem with that, or the prospective challenge with that, is then there are repercussions that happen, say, at that glenohumeral joint where your arm bone meets your shoulder blade. Okay, so what kind of repercussions? Well, your arm bone won't move as well. The humerus won't move as well. So that glenohumeral joint, the muscles that are supposed to be moving your humerus on your shoulder blade may not be able to have as much output, because the muscles that are controlling the shoulder blade aren't able to stabilize the shoulder blade. All right. So there are a number of repercussions that can happen when the shoulder blade is not able to be stabilized and not able to be positioned well. And like Julie was saying, this is a muscular system issue. This is muscles aren't contracting well. And so the scapula isn't stabilized well, or it's not positioned well kind of issue. All right. Additionally, there's also a relationship, as Julie was saying, between the shoulder blade and the rib cage, which means muscles that would help to control your ribs, muscles that would help to control your spine, any muscle in your trunk and spine can have an influence over this. So we are kind of laying out this whole premise of the role of the muscular system, because it leads us right into our next point, which is the common remedies for looking at frozen shoulder are really not focused on the ability for muscles to contract at all. Everything's about trying to improve the motion of the joint. From a symptomatic perspective, it makes sense. Hey, somebody comes in and they can't move their shoulder well. We got to get that joint moving better. It's pertinent for the health of the joint, for that joint to be able to move well. So that's absolutely of the utmost importance. But the thing that we always bring it back to, viewing things from a muscle perspective, viewing things through the MAT lens, is, does motion have to be created by forcing motion there? Or can motion be created at a joint by getting the things that are supposed to be creating the motion actually working better? And that latter is exactly what MAT does.
Yeah, it's interesting. A lot of times when we think about our body and how it's moving, we don't really think about what's moving our body. And the main role of muscles is actually to contract and to be able to create tension and to pull and tug. And when muscles pull and tug or create tension, what a side effect could be is that a joint moves, or you are able to move your body. Now, when we don't have motion in a certain area, or we cannot move in a certain area, for example, like frozen shoulder, it's interesting that a lot of times we jump to this idea that something besides the muscle system is causing this issue. What Charlie and I think due to our education and also our background experience, like what we've seen in the past, is that we always want to see, well, what are the muscles doing and not doing right now? Let's assess that first and see, is there a way that we can improve the situation with just getting the muscles back to doing their job, which is, again, contracting and pulling, which can in part start pulling joints into different motions and positions.
Okay, so now that we've laid out that premise for you of not only what frozen shoulder is, how frozen shoulder is typically characterized, how it is typically addressed by trying to force joint motion, and then why we view things through the lens of the muscular system, we want to talk about where MAT can fit in this whole thing of, hey, I have frozen shoulder, what's something that could possibly help me with it, okay? So like we've said a number of times, we've seen a bunch of clients come in that have been experiencing frozen shoulder, right? And they are typically looking for something in addition to everything else that they're currently doing. They're not coming to us and they're like, oh, this is the only thing that I'm doing. They're doing physical therapy, they're doing massage, they're doing chiropractic, they're doing, injections, they're doing a whole bunch of other stuff, and they are seeing progress, but they want to see either A, want to see progress faster, or B, they feel like they haven't been able to progress enough, or C, they feel like something's been missing with it. And that's really the role that we play, is like, okay, what has been missing from a muscular system perspective, and can we help provide that with MAT? So when it comes to something like frozen shoulder, like Julie said, the shoulder itself is a highly complex area of the body, okay? Not only do we have to think of the area that we typically think of as a shoulder, all right, your arm bone moving on your shoulder blade, but you have to think of the shoulder blade and its relationship to your trunk or your rib cage. You have to think of the shoulder blade and its relationship to your collarbone or your clavicle. You have to think of the trunk itself and how well the trunk can move and how well the muscles of the trunk are working. And then you also have to think of the hips and how well the muscles of the hips are able to support the trunk, and even all the way down to like the feet. And if somebody is standing a lot or running a lot, or they're on their feet a lot, if the feet are dysfunctional, how that's affecting things all the way up. And if there's been any kind of history of, say, neck issues, the influence that can have over the shoulder and vice versa. So there's so much to take into consideration when somebody comes in with any kind of shoulder issue, not just frozen shoulder, but definitely with frozen shoulder.
You're probably thinking, Charlie, you just kind of mentioned every area of the body that could contribute to the shoulder. But we mentioned that because we really have seen shoulder motion be limited, be symptomatic, and we work on an area of the body after following the MAT protocol, and the shoulder motion, the shoulder strength improves. And so that's why Charlie mentioned, every area of the body that could be contributing. But you have to think of this. Our bodies will only allow us to move as far as it feels it can be strong. Like, our bodies are never going to intentionally allow us to move into an area or a position that it knows is vulnerable. And vulnerability in joints comes from lack of muscles being able to do their job. So if your arm is unable to lift and it's been called, or you think it might be frozen shoulder, one way to start thinking about this is thinking, well, there must be something going on in my body that my body is sensing that this is an unstable place after this range. And so my body's intentionally trying to not allow me to go there. Again, our bodies do not make mistakes. I know you've heard me say this on the podcast before. We do not just accidentally lose range or accidentally start creating a symptom in an area. Our bodies do things for a reason. So if you can't lift your arm, it's for a really great reason. A lot of times this reason is because of lack of muscle stability and lack of your muscles being able to contract. So what MAT does is we look for the areas, whether it's really close to your shoulder or not so close to your shoulder, that are causing the muscles in the shoulder to not allow you to fully lift your arm, or whatever motion you're limited in. Normally people start noticing frozen shoulder due to the lack of ability to lift their arm. So MAT is looking for those muscles that are causing the muscles in your shoulders to not allow you to lift them.
Okay, so all this sounds great in theory, but what have we actually seen in our office when it comes to focusing on muscles and frozen shoulder? All right, well, one thing that we've seen is actually by getting the muscles of people's trunks working better, their shoulder motion opens up dramatically, like huge to the point where you look at me and be like, oh wow, it doesn't look like you have frozen shoulder anymore. And we didn't touch the shoulder once. Just by getting the trunk more stable, getting the trunk muscles able to contract better. Like we said, that relationship between the trunk and the shoulder blade, all of a sudden, when the trunk is working better, the trunk can be better positioned, which means the shoulder blade can be better positioned, which means now the shoulder blade has the opportunity to move better. And when that has the opportunity to move better, now all of a sudden the arm bone, the humerus, has the opportunity to move better. And we see huge improvements in people's shoulder motion by working through their trunk. And this is one of the first things that I tell anybody who calls or emails in, or when the first time they come in and they are calling in because they're experiencing some kind of shoulder issue. I'll tell them up front, look, 80% of the time, shoulder issues get pretty much completely resolved by working through your trunk without even ever touching your shoulder. Working through your trunk, working through your hips has a dramatic impact on shoulder function. So having the mindset of, well, you know, my symptoms in my shoulder, so my problem must be in my shoulder, so I just want, you know, somebody to look at my shoulder, that can be that can create a lot of tunnel vision just around where the symptom is, and it can cause people to miss a lot of contributing issues in the trunk, in the hips, and like I said, even all the way down to the feet. So yeah, most of the time when people have shoulder issues, working through the trunk, working through their hips, getting those areas more stable, and then as a chain reaction, allowing the shoulder to move better. All of a sudden, like I said, well, the shoulder moves better, but they feel so much better. The shoulder functions so much better. And from an outside perspective looking in, you wouldn't look at them and be like, oh yeah, you still have frozen shoulder.
Mm-hmm. Charlie, I love what you brought up about, you know, working through the trunk to address, and I don't want to say address things in the shoulder, because when we're working through the trunk, we are really addressing things that are in the trunk. But what we don't know is how that relates to someone's symptoms elsewhere, because symptoms are not always, and usually actually aren't, the cause of the issue. And I think that's such a great point that you brought up, because so many times people come in and they're like, hey, my shoulder's hurting. Can't you just work on my shoulder? And we're like, okay, well, maybe. Let's do the assessment. Let's find out where your body has its limits, its mechanical limits, and I'll let you know what I find. And so often there are so many mechanical limits, you know, in the trunk. And that is what drives muscle activation techniques. We have to work on where your body is not able to contract. And so it would actually be not wise of us to just jump into the shoulder if that's not where your body's unable to contract. And so when people have the idea of my shoulder hurts, please work on my shoulder. But what if the thing that actually will help you improve and actually get to your goals is not by working on your shoulder? And the likelihood of you already trying to work on your shoulder, someone else trying to work on your shoulder, is probably pretty high. So, you know, us addressing it in a different manner can actually only do you better. And, you know, maybe you have another MAT specialist and whoever you're working with, you've probably noticed that sometimes they're not working in the area that is actively bothering you, actively limiting you. It's probably not the area that you came in thinking you would get worked on. But our main goal is to improve where your body is lacking in muscle control. And this does wonders for all areas of the body, especially the shoulder blades relationship and the shoulders relationship with the core and with the trunk. So it's just a really interesting area that we consistently see really improve on shoulder function and shoulder mobility, to the point where many people are like, well, I don't think I have frozen shoulder anymore. I thought you don't treat frozen shoulder. Well, we don't. We look for where the muscles aren't working well, and we improve upon that. So maybe your frozen shoulder, air quotes, was really just a result of lack of muscle function somewhere else. But who knows? We wouldn't know unless you did an assessment.
Now, the next thing to keep in mind when it comes to frozen shoulder is, yeah, it might be something like the trunk or the hips that isn't working well, but it also may actually be the kind of part of the shoulder that's completely controlled by muscles, all right? And that is the shoulder blade. And a lot of times, because the limited motion is around that glenohumeral joint, how well the arm bone moves on the shoulder blade. The motion and the stability of the shoulder blade itself may kind of be taken for granted, but that is one of the most impactful things that we see after working through the trunk, getting somebody's shoulder blade to be able to move better, getting the muscles that control the shoulder blade to be able to stabilize the shoulder blade and move that shoulder blade better, has a huge impact then on how well that glenohumeral joint moves, how well the arm bone moves on the shoulder blade, which then ultimately ends up being the part that we can start to touch up. And don't get me wrong, it's like by the time we get to addressing the muscles that support that glenohumeral joint and that would help to move that glenohumeral joint, by having the trunk working better and by having the muscles that control the scapula working better, all of a sudden there is huge improvement by working through the muscles of the glenohumeral joint that would help to control and position the glenohumeral joint. Even though the majority of the issues have already been taken care of, then that's that kind of last little piece that can help to bring it all together. So kind of at the end of the day, what we want to get across is that with muscle activation techniques, we're able to see great improvement in joint motion. We're able to see great improvement in joint stability. We're able to see great improvement in muscle strength and muscle output by focusing on where muscles cannot contract and getting those muscles to contract better. And with something like frozen shoulder, we've had tremendous success at helping people get back to doing the things that they love to do with minimal shoulder issues by getting their muscles to contract better. And rarely is it just by focusing on the muscles in the shoulder. More times than not, we need to be focusing on muscles elsewhere because of the complex relationship that the shoulder has to the rest of the body.
So let's jump into some practical tips. You're listening to this, you're thinking, all right, got to start working on this issue. And what are some things that you can do? The first is make sure that you're cleared for exercise by your doctor. Muscle activation techniques is an exercise-based technique, so you do need to be cleared by your doctor. And also, our next tip is going to include exercise, so you do need to make sure that you are cleared for exercise to participate in this. Our first tip, besides going to see your doctor, is to make sure you're doing your resistance training. Resistance training in the upper body and elsewhere, as we've talked about how much it influences the core and the trunk and the hips and the feet, and also some things in your neck can influence your shoulder. Make sure you're keeping these areas strong and maintaining these areas using resistance training. Now, you do want to make sure you're moving slowly with control. You're not overdoing it because obviously you do have an issue right in the shoulder, and particularly in the shoulder, be mindful that you're weight training and resistance training in ranges that you can attain yourself. So if you can't lift your arm past 90 degrees, well, then you're not doing any resistance training with your arm above 90 degrees. So just be mindful of that. Stay in the ranges that you can attain by yourself and keep those areas strong. What we see happen a lot is that when we strengthen the ranges that you do have, your body will slowly start to open up more ranges that you did not previously have.
And then our third and final tip is look online, go to muscleactivation.com, click on the Find a Specialist tab and find a certified MAT specialist in your area that you can go schedule an appointment with, go get your body assessed by, and go have your muscles addressed. MAT can be massively impactful on your shoulder's function as well as on the function of the muscles throughout the rest of your body, which can all impact your shoulder. So if you feel like you are not progressing as well as you would like to with your frozen shoulder case, or if you want to just get your body assessed overall and figure out where you may be more likely to have injuries, to have compensations because of different muscular dysfunctions, go to muscleactivation.com, click on the Find a Specialist tab, and find a certified practitioner in your area so you can go get your body assessed, go get your muscles addressed, and have your muscles working as well as they can so you can continue to do all the things you love, for as long as you want to do them. So who do you know that needs to hear this episode? Who do you know that has been experiencing frozen shoulder, is frustrated because they have frozen shoulder, or maybe has a history of frozen shoulder and is looking for something that maybe has been missed in the past? Share this episode with them so they can learn the value and the impact that muscle activation techniques and the muscular system can have over something like frozen shoulder. And while you're online, if you wouldn't mind, head on over to iTunes and leave us a rating and review. It means so much to us when you do this because it allows other people to find this information easier. People who are looking for podcasts on exercise, people who are looking for podcasts on health. It allows us to show up in the searches higher. Well, thanks so much for tuning in. We always appreciate it. Have a fantastic week, and we'll talk with you all next week.